ladies and gentlemen, everyone, welcome to this Talking to Doctors video series. My name's Julie McCrossin, and I'm a cancer survivor myself. I was treated 8 years ago for oropharyngeal cancer, tonsils, tongue and throat, with radiation and chemo. And the purpose of this series, hosted by Cancer Voices SA, Cancer Voices South Australia, is really to share practical tips about talking to doctors, these all-important conversations. And we're looking at it from the point of view of both patients and family. And it's my great pleasure to welcome a mother of a young woman treated for cancer with proton therapy, a kind of radiation therapy in the United States. And Vikki Bedford now lives in Adelaide, and she's care of Cancer Voices SA, the hosts of this series, and also a facilitator of a program that Cancer Voices SA run called Survivors as Teachers, and it's run at the University of Adelaide for third-year medical students, and all of that is voluntary. So welcome, Vikki. Thank you for coming.
Hi, Julie. Thanks for having me.
Just in a nutshell, what was the cancer that your daughter was facing, and the sort of treatment that she's had, and how she's going now?
Yeah, she, at 2 years old, she was diagnosed with a sarcoma in her spinal cord called Ewing sarcoma. And she underwent 9 months of chemotherapy with 5 weeks of radiation concurrently running through. And that was back in 2009 when we lived in the US. And she is now a cancer survivor. She is 13 years off of treatment now, and she's doing quite well. We still have some long-term issues because of the location of the tumor, but overall, she's a very happy and healthy 15-year-old girl.
Because that's one of the challenges, isn't it? When very young children have cancer, there's the issue of, I think they call it late effects. Is that the language that's often used?
Yeah, the long-term side effects of some of the drugs and treatments that are used, because it's at such a young age as well, things like her teeth didn't develop the same way, with just different treatments. And so, we never know what we're going to run into. Every day we have a new challenge, but each time we've been able to overcome it. And with the new technologies and treatments that are available for even those late-term effects, we're finding it's challenging, but it's also really good because we're learning new things.
We're going to put onto the Cancer Voices SA website another interview that I've done with you, where we talk in some detail about your daughter's treatment. For this discussion, we're talking really about communicating with doctors and trying to have the best and most effective conversations we can. So can you tell us 2 or 3 of the challenges that you faced as a mother? And then we'll talk a little bit about what your advice is to other parents, but also, I guess, to doctors who may watch this as well. So what's your first challenge?
I think my first challenge was the information overload. When you get that diagnosis and even educated people don't understand what's being said and what it means, and where do you look for information on what you've just been told? That diagnosis, it means a lot to the doctors, but it doesn't mean a lot to us on the other side. And then understanding like where I go to look for true, genuine information that isn't just stuff that's on the internet, that isn't vetted by peer reviews and things like that. So I found that information overload was really tough for me to get through.
So let's start with your advice in relation to that, because wow, that's big. So some practical advice to other parents who might be watching this?
I think my best piece of advice I could say is always carry a pen and paper. I had one by my bedside. I had one sitting outside my shower, because it seemed like the most inopportune times is when I would think of something to ask the doctors, or I'd think of, oh, what did that mean again? Because, you run through those conversations you just had with the doctors at random times later, and you're thinking, oh, what did that mean? Or how did they spell that again? And I took it everywhere. I had it with me. My daughter was 2 whenever she had cancer, so I had a diaper bag still. So I'd keep it in the diaper bag. And that was back before phones had the really good notepads on it. But I also carried it into the doctor's office, because I would find, even sitting in the waiting room, overhearing other people's conversations, I would get, oh, you know what? I should ask that as well. I hadn't thought about that coming up. What's the next step here? Because you get handed a protocol sometimes of what your treatment's going to look like, and it looks like a foreign language. So how do you decipher that? And what does it mean to you as a person? Well, asking those questions. But if you don't write them down, you'll forget. And then the second you walk out of the doctor's office, you're like, oh yeah, I was going to ask that.
That question of what to look at on the internet, what is your blunt advice to people about that?
Oh, don't go down the rabbit hole. Do not go down the rabbit hole.
What do you mean by that?
When you Google things and you look at the images and things, an example, Zoe's recently had what they call pelvic halo traction. And when you Google that, there's some really scary pictures because it's kind of an archaic look at the way that things were done years ago, but the newer stuff hasn't had all the new pictures. And so you don't necessarily know what's genuine and what's real anymore. You know, you hear about the deep fake videos and things that are out there. There's a lot of crazy pictures on the internet, and there's a lot of crazy information that is more opinion than fact. And so finding those websites that have real information that you can understand to the layperson like me, that was a really big ask for me. And that was something I actually sought from my doctors and specialists that we saw. Things like Targeting Cancer was a really great website. That's been a great resource. And going to websites like we worked with MD Anderson. So their website was really great, full of good information with links to other organizations that could help us out.
And I'll just explain that Targeting Cancer is an Australian and New Zealand website created by basically the radiation oncologists in Australia and New Zealand. So it's all evidence-based information that's regularly updated. And MD Anderson is a famous treatment centre in the United States. So the tips I'm getting there is ask your doctors, your clinical team members, where on the internet I should go for information. Yes. And don't go Googling yourself, because you could give yourself a terrible fright and it may not be accurate anyway.
Exactly. And you got enough anxiety running through with what you're dealing with. You don't need to add any more to it.
What's another key challenge in communicating with doctors?
The lack of understanding of medical jargon was a big one, not just the acronyms, but even things like what is Ewing sarcoma and what are stages of cancer? You know, what's malignant, what's benign? These words get thrown around and are used so flippantly because that's what the doctors, they're trained to do. But understanding what they mean and what they mean to you and how it's going to impact your life over the next few years, even things like palliative care, all those terms that can be given to you throughout your journey that you may not understand. Again, I go back to my pen and paper, write them down. And a lot of times I'd even ask for the spelling of things. I know it sounds silly, but for me, especially being in Australia now, I don't quite understand accents still. And so I ask for the spelling because what it sounds like it's spelled, especially medical terms, doesn't always come out right. And so whenever you do go to look them up, understanding the spelling was a big thing, because it can lead to two different rabbit holes as well. If you miss the letters and some of those drugs, I tell you, they're about 15 letters long. So really understanding the jargon, and again, asking the doctor. Don't be afraid to stop the doctor and say, wait a minute, what did that term mean? What do you mean by that? Because getting that explanation will also help lower the anxiety. And again, I go back to your mental health is so fragile in this state, whether you're the patient or the carer or the family supporting, you need to make sure that you're lowering any anxiety inducing situations if you can, like mitigate those while you can. And some of it is simply asking questions.
You know, Vikki, when I was a cancer patient, I relied heavily on the Cancer Council booklets. They're yellow booklets that are often arrayed on walls at cancer treatment centres. And many of them have I can't remember the proper term, but like a list of the words, keywords and definitions up the back. And they also have a information and support line 13 11 20, and we'll pop this up on the screen, 13 11 20. That's a free call across Australia, where again, you can get information sent to you or you can get it online. So I'm just interested, did you use the Cancer Council booklets, or did you go more for what was, oh, of course, you were in the United States.
Yes, it was a little bit different, but in a really good way, I think, because what I've learned is I've actually brought some of it back here to Australia to help use, because some of the things we were given, she was given a cocktail of 5 different drugs, but for her protocol, there were 8 available. They gave us a fact sheet on each drug, and it was broke down into the types of side effects and whether they're rare, normal, or most common. And it really helped kind of, again, it dispelled some of the myths that could be had whenever dealing with some of these treatments.
And here in Australia, our pharmacist can give us written information about drugs. Again, the language can be complex, but that's something you could bring to your cancer team or to your general practitioner for help.
Exactly.
Might be another strategy. Look, we've got time for one more challenge. Would you like to give us another?
I think this one I actually spoke to Zoe about, because it was one that she and I both.
This is your daughter, Zoe.
Zoe is my daughter, who's 15 now, and I'm trying to involve her more in her care now, and it's something we still deal with. Is that feeling of being rushed or worried that whatever you ask might offend the doctor or seem like you're second guessing them, and then wondering how that's going to impact the treatment that you or your child's getting, and just. That feeling of power imbalance, I think, was always a really big struggle for us throughout the years, especially with new doctors. And so trying to balance that out was a really tough one for us.
Any tips?
To me, it was just comes down to just be brave and speak up. If you don't like the way that treatment's being done, make sure you speak up. It's not going to impact your care. If you're in the proper facility, you have a right to speak up for the way that you're being cared for. And if you don't like something or if something's happening that you don't understand, stop them and let them explain it to you. A prime example, Zoe at the age of 3 was about to get an infusion put into her line. And the protocol in the hospital we were at was you cleaned the top of the line 3 times with an alcohol swab before you connected. She knew the routine really well, as did I, and she was watching the nurse, as she always did, very careful about watching the nurses, what they're doing, asking what they're putting in. And the nurse only swabbed it once. And Zoe, at 3 years old, stopped the nurse and said, "No, you didn't swab it 3 times. You must do 2 more before you can connect it." And the nurse actually stopped. And she wasn't mad. She was taken aback that she noticed. And then she thought back and she said, "You're right. I'm really sorry about that." And she did it properly and reconnected. And it's amazing if you can do it in a way that's a really constructive and work as a team, and rather than the friction between the 2 groups, and find your power balance, find where your voice can be heard and used the best, rather than it's not a complaint, it's an inquisition, basically, asking these questions because you need to know it's your care.
And an infusion is often a drip of some substance going through a tube into a cannula, a connection they've put in a vein. I'm just showing on my hands here. and they're connecting 2 points so the drip can come in. And they give us these drips for all sorts of things. With cancer, of course, chemotherapy can be one of the things. Look, what a pleasure to speak to you. Really good practical thoughts. And I know I speak for everybody watching that we wish Zoe well for her recovery, and we applaud you for your diligence as a mum and as an advocate. So thank you very much.
Thank you, Julie. Thanks for having me.